Hello, and welcome to Season 4 of our podcast. I'm Amy, your co-host, and I'm incredibly excited to revisit an episode from our previous season that resonated deeply with many of you. No time to waste getting help for your child's drug use. In this episode, we'll delve into proactive strategies for preventing and addressing adolescent substance misuse. We'll discuss the vital importance of early intervention, the need to overcome stigma, and how to provide essential supports to guide your child towards a drug-free future. Our special guest, Terrence Spain, introduces us to the groundbreaking 988 helpline, a nationwide resource for those grappling with drug misuse or mental health concerns. We believe that knowledge is power, and as parents, we can arm ourselves with the right tools to help our children. So let's jump in without further ado and re-explore this episode in continuing our journey of creating a safe and healthy environment for our children. Tune in now and let's get started.
Hey, I'm Jodie Sweetin. Thank you so much for joining us for another episode of Awkward Conversations. Last week, we discussed recognizing some signs of use and substance abuse in your kids and what you can do if you see those signs. And now today we have some wonderful guests on our show who are going to tell us about some resources that are available to parents and caretakers if they suspect that their child is using drugs, and how to have those conversations and be proactive about getting your kids the help that they need. I'm joined by Amy McCarthy joining us today.
Thank you so much, Jodie. We have a great show today. First up, we have Terrence Spain joining us. Terrence, can you say hello and tell us a little bit about yourself?
I work for the Oklahoma Department of Mental Health and Substance Abuse Services. I know that's a lot of words, but I work as the senior manager for the state for adolescent substance use and co-occurring disorders. So basically what that means is I build a program for the state of Oklahoma around how we address adolescent substance use and co-occurring disorders for our state.
That's incredible. Thank you again for being with us today. And we also have Rob Vincent with us as well. Rob, hello, and tell us about yourself.
Sure. Thank you for inviting me, Jodie and Amy. My name is Rob Vincent. I am the Associate Administrator for Alcohol Prevention and Treatment Policy here at the Substance Abuse and Mental Health Services Administration. But I have the pleasure really of leading the work around preventing and reducing underage drinking nationally, and have worked as a clinician, program developer, both in adolescent treatment for right at 35 years.
Rob, we know all of these acronyms, all of these long terms. It's hard to keep up with, but most people know your organization is SAMHSA. Is that right?
So thank you so much for joining us today. And we're talking about resources and things for parents once they have potentially recognized signs of use. What are some of the resources, top resources that you can think of that are available for parents who suspect that their kids might be using substances?
One of the things that have kind of come along recently is the implementation of 988 nationwide. For us in the state of Oklahoma, 988 has become the automatic hub for any type of resource, whether it be substance use or mental health. And in particular for any parent who's looking for help for their kid for substance use, our 988 can give them access to a warm person who's actually talking and speaking with them and helping them through the situation and working to connect them with a warm handoff to the next level that they need to get to start receiving services.
And as a reminder, 988 is actually works across the country. It is a mental health a hotline, a substance abuse hotline, and you can get a lot of really great resources. So whatever state you live in the U.S., 988 is a really great number to call. Rob, I'd love to hear from you as well.
Hey, thanks for that, Terrence. There's building off of your comment around 988, which is an amazing resource. We also here at SAMHSA have a whole new piece called Find Support. And our Find Support page really sort of helps people, navigate the system a little bit. Everything from how to pay for treatment, what kinds of treatment. It links to some of our other federal partners around navigators to help a person who got to the place, Jodie, where you had spoke to. I've now identified, this is bigger than a bread box. I need to do something here at this point.
Right.
This will help you sort of walk through that a little bit. In addition to that, there's one other tool that I would offer up as well, which is our Screen for Success. And that really is, I often refer to it as the panic button. So when you get to that place and I'm trying to establish what degree there's a problem, and then find resources local to me. It really aids with that idea. It works in tandem with our Find Treatment, some of the other locators that we have.
Great. And, finding resources is so important, but also finding the ability to pay for some of those resources. I know myself, I was always incredibly fortunate in my struggles with addiction and recovery that I was able to access and afford treatment. And that is something that is not always the case. And for a long time, mental health and substance use was not covered under insurance. It finally was covered, I believe, under the Affordable Care Act. And, I think it's really important to recognize that there are through SAMHSA, there are ways to find out grants, scholarship programs, free treatment, all sorts of things that are out there that I always like to remind people about, that you can find recovery and you can find it, without costing anything, but that there are times that, you do need to go away for treatment, or you need something a little bit more serious, and that, sometimes people don't have those resources, but there are ways to find them.
Absolutely. And I think, something we talked about last season and bears repeating is local health centers and pediatricians are a really, wonderful resource, to guide you in your community, especially now with integrated primary care and mental health professionals on site and things of that nature. So when families are stuck and they're not really sure where to turn, their pediatrician is a wonderful resource for sure.
Yes, that's definitely one of the things we've worked on trying to do here in Oklahoma, is really engaging our pediatricians and doctors and taking more of a prevention aspect with it as well, and having those conversations. We talk a lot about our neurodivergent youth, and if you don't understand, our neurodivergent youth already are utilizing substances to help them with ADHD, ADD, anxiety, but this also provides the opportunity to have a conversation around how substances affect you when you're already on those medications. So we really want to start pulling that group in as well as a resource of being able to help out, not only having that awkward conversation, but also if substance use treatment is needed, and having that one as well.
To your point, I think it bears repeating. The research is pretty clear. If we can get there before the age of 15, we can literally take decades off the substance use career. It really is important to get to that space, because if we don't, then what we really do is we allow these children to experience lots of trauma and other moments in time that will really limit their abilities to thrive and have a successful life.
What is the best way for parents to be able to support their kids through this journey of finding recovery, but also to have that initial very awkward conversation?
Well, I'll say the first thing is making sure you're in a safe space when you're ready to have that conversation. Making sure that you're in an area in which you feel safe as a parent and your child as well. Those are hard conversations to have, and making sure that you're going to be open to listening and not doing all the talking as well, and leaving a platform for that to occur. And I always like to tell parents, the first thing is this: you're not alone. You're not the only parent who has a child who's struggling with substance use issues. You're not the first family.
Well, to your point, Terrence, so many parents oftentimes feel like it's just us. What happened? Why is this us? Along with that, I would add, it's very important not to overreact. It is very likely you could hear something that may be unsettling, that you may have not thought, my son did that, my daughter did this. All of that's possible. But what's really important is to be present in the space and the conversation. And I think genuinely to show your love and support, that you honestly care about the health, wellness, and well-being of your child, and that you're there as a family member. And no matter what, things get bad sometimes in these conversations. Right. They're not pretty moments. They're embarrassing. That's the nature of addiction in and of itself. Right. So the question really becomes, how do we have a conversation that just accepts you where you're at, and then what do we start to do together? How do we find a way to move forward?
You're watching Awkward Conversations Season 4.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
Welcome back to Awkward Conversations Season 4. Right. One of the things that I've always talked about, having been someone that struggled with addiction at a young age and with substance abuse problems, was, and I tell this to parents now and also to myself, but it's not a personal attack on you. Their substance use problems, yes, it may be trauma related, or it may be that they, the way their brain works, they're neurodivergent, or they are, looking to self-medicate, all those things. But I always try and remind parents, and it's something that comes up a lot in Al-Anon, which is a support for people who are affected by others drinking and using in their families, is that this is not a personal attack. It's not that you are a terrible parent. It's not that because removing that makes the conversation much less heated. It makes it, now we're having a conversation about how to help, not about how you've hurt me. Mm-hmm. And that can be really hard. And I know as a parent, I've had to learn the skill of being like, I'm going to walk away right now, and we're going to have this conversation later. And I would highly recommend to parents that if you find a substance in your teenager's room, take a moment. Yeah. Take a moment, center yourself. Don't go running in and screaming at them. And I have had this experience as a kid with my mom trying to do her best of, you're not going to have any line of open communication in that moment. And it's so hard. And I'm sure you can speak to this as someone who works with adolescents and families and things, finding that moment to have the right conversation where you're in the clear headspace. And oftentimes if your child is struggling with substances, you may be the only one in a clear headspace, and you need to be the driver of the conversation and keep it going to a productive place.
Yeah, it's going to be such an opportunity for modeling. And so it requires you as the caregiver to take that step back, prepare yourself mentally for this conversation. Yeah, so I think being able to, get yourself into the right headspace, be able to, be prepared for this difficult conversation. And maybe ask your child, when is a good time for them today to talk about this? They might not be in the right headspace, so you've got to give them, some of that time,
right?
Make that plan.
Absolutely, and we know that every day of kids struggling with substance abuse can be, it can be the time that you don't have anymore if you wait to have that conversation. And I think by waiting, we want to make sure that people know, we're not talking days, we're not talking weeks, we're not talking avoidance. We're talking until you're not red in the face and really upset and angry at your kid, because anger never leads to a good conversation. And you may still get there. This is hard. Parenting is hard, but I just really I know that coming into it with the calmest headspace that you can in the moment is so key to actually having a conversation and not a lecture and not an attack. Which is the absolute wrong way to go about dealing with any hard conversation, but particularly with substance use. If you don't have the experience of substance abuse in your family, it does feel very isolating and it does feel very shaming. And so, take that moment to take a deep breath and remember, like Terrence said, you're not alone. You're not the only parent going through this. This is not your kid is not a horrible person. You are not a horrible person. Mm-hmm. But what is the solution? And it's very hard to be in solution when you're screaming. Yeah. I know that from personal experience.
I want to add to that, curiosity and empathy are a really beautiful combination here around recognizing too that developmentally young people are going to take risks, they're going to experiment, and that doesn't, now we want to intervene because that experimentation can be very dangerous. Right. But that anger towards your child, like, this is developmentally appropriate sometimes for them to engage in these, kind of activities, for them to make mistakes. And so coming to them in a state of empathy, understanding that this, is something that might not fully be in their control, and being curious about what's kind of going on for them, I think is a really important combination here.
Questions. Always ask questions. It's a much better way to have a conversation.
Hey, and one of the other ways too, I think one of the things that we truly use, or we always as a resource, is we have a group called Parents Helping Parents, and it is nationwide, state to state, and maybe even having a conversation with them prior to having that, and getting some tips on how to have that conversation from someone who's already been through it.
Yeah, I love Parents Helping Parents. There's a parental stress hotline that they have in Massachusetts, where I live, which is a wonderful 24 hours a day. And, all the resources today, including that information about Parents Helping Parents, will be in the show notes below today. So we got your back, parents.
Yeah. So, that first step of really just getting past that stigma, the aspect that, number one, like, oh no, I'm not a great parent. And now people in the community are going to look at me in a certain way. They're going to look at my kid in a certain way. And understanding that, like, that stigma for our community and getting rid of that is huge and important. And then understanding, yes, that each child is different. You may be able to have a conversation at 8 o'clock in the morning with one kid, and they may be able to engage with you. But your next kid, you might not be able to do that. It might have to be an evening conversation. It might have to be an after dinner conversation. And once you can start to move and get past that and have those conversations, then you can start building your plan. You can start connecting to the individuals and individual resources you need to connect to say, okay, what's the first step? I always say first step is we find someone that can assess. We want to assess the situation. We have the saying here, we want to make sure that every child gets the appropriate service at the appropriate time, because your kid may have just started experimenting with substances, and they don't need to go into a treatment facility for experimenting. Right. And that only makes it worse. So that's why we want to make sure that we're doing a true assessment, giving that child exactly what they need, and providing wraparound support for that family, so that they can then also enter the world of recovery. And my biggest thing also I say to parents is that children will relapse. That's going to happen. We just have to realize that recovery is possible. Right. It is obtainable. It does happen, and relapses do occur.
Yeah.
It's a part of the process of recovery, for sure.
Yeah. I talk about it a lot. I first got sober when I was barely 18 years old, and I had, a lot of stumbles along the way, and a lot of ups and a lot of downs, and in treatment and trying to do it on my own, and 12-step and all of this. And, again, like they say in recovery, it takes what it takes. But I remember having such a difference with the relationship with my parents once they came to a lot of the understanding of, and finding the resources themselves through Al-Anon, through other parents, through all of those things. It really did sort of take away that personal attack element from both of us, and allow us to have listening, curious conversations about what was really going on.
Well, I just wanted to build off of what you're saying, Jodie. The good news is that, most people that actually go and receive formal treatment and other kinds of treatment actually get into long-term recovery. So it's really not a bad track record. I think it's just a matter of really how it is that we come together to support and sort of find that frame of mind where we don't get ensnared into our own fear and panic. And as a parent or caregiver, it's so easy to go down the vortex of, this is the most precious thing in my life. I'm actually scared. She just said something that I wasn't prepared for. Now what? And I may not have the answer. And that's okay. And I think sometimes parents, Terrence, to your point, sometimes parents don't just take that minute and go, okay, we can walk through this. I just need to not go into the dark.
And, no parent wants to feel like they don't know. No parent wants to feel like they don't have the answers to how to help their kid. And in situations like this with substance use, with mental health, all these things, the answers are so much bigger and so much more nuanced and are so beyond the parent's scope of what as parents. And it really does fall into the realm of professionals and of SAMHSA and of, states to be those resources for parents. So I'm so glad that we, have those links here for parents to find and can really help them with that. And, to know, like, it's okay if you don't know, take a moment.
There isn't a particular treatment out there that's like, oh, that's it. That's going to do it. Or it worked for this kid, so it's definitely going to work for you. Every kid is different. Treatments are different. And understanding that having a good relationship with whoever your primary therapist is for your child, and making sure to guide in that and saying, okay, I understand that this is who your child is, but we may need to look at this treatment because this might work best for your child. There's no magic pill. And I love to tell parents that, because a lot of times, a lot of therapists here, a child comes in, they're like, okay, fix them.
Right.
This isn't about fixing anyone.
Right.
This is about providing them with the resources, the support, and the treatment that best fits their needs, and being able to guide them to recovery.
And when we were talking about sort of different, treatment modalities and different types of treatment, there's not, like you said, there's definitely not a magic pill, but there's also not one type of therapy, one way to combat and deal with substance use. So I would love to hear some of the ways that you both have that have been found to work really well with substance use.
Sure, there are different types of therapies: inpatient, outpatient, residential care. All of those really depend on the level of severity. Then there's all kinds of different types of individual kinds of group therapies that can happen. Things like cognitive behavioral therapy or motivational enhancement kinds of therapies. And finding the right therapist or solution really is incumbent upon doing a little bit of research on your own behalf. And some of it may be a little trial and error. There may not be a good therapeutic alliance or a good match initially. Not all therapists are, I hate to say it, adolescent friendly. And you need that. Not all have real good depth of experience in terms of cultural nuance or the kinds of things that might resonate with your child.
Rob, I always say to families, sometimes you have to kiss a few therapy frogs before you find your therapy prince, princess, or royal. So many people go into therapy thinking, you're a therapist, you're going to help. Not everyone makes that kind of connection. Right. And so sometimes you have to prepare young people and parents to know, you might have to meet a couple people before you find really the person who's going to be the right fit.
I mean, they're showing up for a job. Don't be afraid to interview them. Yeah. Ask them some tough questions.
Yeah, ask what their experience is with adolescents. Like you said, there are really wonderful therapists out there who deal specifically with adolescents or who work with adolescents really well. And not everyone does. And oftentimes I have found when talking to therapists, I'm like, okay, you have more than just talking in your tool belt, which is really important. And I think most people have an idea that therapy is just talking. And it's just, you're going to tell me stuff and I'm going to reflect it back at you, and that's really not how it is at all.
Not everyone is trained in substance use treatment, especially adolescent substance use treatment. And so understanding, do they come from an abstinence forward model? Are they, harm reduction? Like what are the pieces that they're going to provide to your child lining up with what and what the other professionals and people and adults in your child's life are in agreement with. And so again, for young people, for adolescents, the message of abstinence is really important to prevent, that brain from getting that exposure. So being sure that they're aligned with that, right, I think is really important.
Yeah, so one of the big things for us, especially within our state that we look at is culturally, how does that therapist or that mode of therapy fit into your family structure? Because I think it's really important that the therapist understands that if your Native American culture is important to you, then there's an aspect of that they need to know when they're working with your child, and how you view the use of substances, how you view how do you view recovery and what it should look like, even how they communicate with your child. And if you don't understand those cultural nuances, then more than likely, that's not going to be a good connection for your child in their recovery. They could see that as a hindrance or a barrier, because if we can't even communicate and you don't understand my culture and my communication type, how do we even move to a point of recovery? So really having conversations, as Rob said, you interview them and say, well, have you worked with Native American children? Have you worked with African American children before? Do you understand the cultural differences that are there, so that you'll be able to communicate and kind of help us out on this path to recovery?
There's no, quick magic bullet. There's no quick pill.
Right.
And part of the treatment, really, what we know, the outcomes are best when the whole family is engaged in some form of treatment. So whether that be family therapy, whether that be Al-Anon or parent support, whether that be your own individual therapist. In our program, all of the parents and caregivers get their own, person assigned who's helping them through this journey. And so, please, please, please seek out your own support during this time. We know how stressful it is. Yeah. And it, again, models for your child that it's okay to seek support. It's okay to seek help. And it's okay not to have all the answers.
And reminding them that it's the family dynamic and not just the quote unquote identified patient that is, the problem.
Making sure not to forget the other siblings. One of the great programs that we have is what we call Peaceful Family. And it gives the opportunity for those siblings to have an outlet for talking about how substance use has affected their family, while also taking some of the load off of them, and realizing that everything that's going on with their sibling and who may be struggling with substance use is not something that they have to struggle with, or it's not their fault, and they see the stress that comes about from everything going on, and you want to make sure to take care of them as well, because they could see it as an avenue of, oh, well, if older brother did it, then and he ends up getting all this attention and everything's focused on him, maybe then that's what I should do. And Peaceful Family kind of helps out with that. But I'm sure there are resources all across the state.
What can parents do in those situations where they have maybe had the conversation or confronted their kid about the problematic substance abuse or experimentation, and the kid's like, I'm not going to do this? What are some of the ways that parents can have boundaries and things in order to, not give up in that moment, but also to keep their kids safe and continue on, fighting that battle that is recovery?
Well, Jodie, at least from my perspective, I think the first part of that is really to stay in the conversation. I think that it's easy to overreact and want to say, you can't do that in my house. I often have seen parents or worked with parents who kicked their 14-year-old daughter out on the street because she was using drugs and seeing an older boy. And I'd often have to, and it's usually the father, I'd usually have to explain to him, I said, so the very thing you were hoping to avoid, you actually created a worse scenario. Because where do you think she's going to go? She's probably going to move in with him and probably continue to use drugs. You're not going to be able to have that conversation again. So part of it is not to overreact, but really to stay in the conversation in a way that allows you, I get it, the behavior's not great and it probably hurts and it probably scares you to death. But if you're not there to have the conversation, then there's really nothing else you can do. There are lots of resources out there around to help parents. Things like community reinforcement and family training are excellent resources. Things like motivational interviewing, these are methods and techniques to help you develop a little discrepancy in the conversation, not overreact, not get hooked into sort of the downward spiral that you had talked about earlier.
Yeah, I think what comes up for me or so often in my work is parents will say, but they don't want to stop. I just want them to want to stop. And, it's an opportunity to think about how, developmentally again. Like their brain is not primed to not take risks and, and all of these things. And so, being able to say, you have, like you've again talked about the bumper so many times, like you have an opportunity to shape their behavior here, to prevent the exposure by like putting in expectations and consequences and rewards. So they're, and when their brain, is getting kind of the dopamine hits and the things that it's getting from using substances, if they don't know what to do in place of the substance, it's going to be incredibly difficult for them to stop using substances. So don't give up just because your child is saying, I don't want to stop, I'm not ready. This is a part of the progression of a substance use disorder. Right. This is developmentally appropriate when they say things like this at times. And so you continuing to get support as a parent, finding the ways that you can shape their behavior, reduce the exposure to substances, increase those other, types of supports for them, is all good steps.
Yeah, it's a road to recovery, not a, you're not getting there and it's a destination and, it's all inclusive and everything's done. And I think a lot of parents think it's either all or nothing. And really it's 2 steps forward, 3 steps back. And, obviously there's always safety concerns and things like that parents have with their kids using, if they're using in the house, if they're putting other siblings or family members in danger. And those are, much more extreme situations. And those, obviously need to be dealt with. But I think if you can, don't cut that cord of communication. Don't cut them off. Don't shame them. Don't end the conversation. There's still hope. There's still a chance.
Yeah, this is a medical condition, a
Right.
substance use disorder. And so you have to think about, would you kick your child out who was, not complying or not kind of following the suggestions of their physician because they had diabetes or they had, some other type of condition? I think it can be really helpful to compare. How would you respond to any of these situations if your child had any other medical condition? And you'd support them and you'd trudge through it with them. And that's what's
deep
important
breaths
here.
and patience, parents. Well, this has been a great conversation. Terrence Spain, thank you so much for joining us. Rob Vincent, Amy McCarthy, as always. I feel like we really gave parents a lot of hope, a lot of options, and some fantastic resources that will be available in the show notes after this. So thank you so much for joining us today. Really appreciate it.
Thank you. Recovery is real.
Yes, it absolutely is. So thank you so much for joining us. And we are looking forward to more conversation and more awkward conversations next week. But just remember, keep those conversations going. Well, that's all for now. Tune in next week for more of Awkward Conversations Season 4. Think about it. Our social media feeds, the movies we choose, and even the products recommended to us are all customized to our preferences. So why aren't we taking the same approach with something as vital as preventing substance misuse in our kids?
You have to really make sure that any good prevention that is culturally specific really binds itself on what is the culture of the community in which you're trying to attract. Here are some ideas, but we want you all to create what we're going to do as we outreach to your community and listening to them and letting them formalize that so it becomes their idea and their process. That's the strength.
Operation Prevention is an initiative that we began in 2016. We came out with our multi-drug exploratory program, and one of the most important parts of that was a parent toolkit. Because parents, a lot of times, they want to talk to their kids, but they don't know what to say. And so it was a great tool to say, look, here's some ways that you can talk to your kids. Here's ways to start the conversation.
Parents need help and support and deserve help and support.